We are here today at Jacaranda Primary School, where we are holding the 3rd annual Kadibo Medical Camp. The medical camp is a community initiative that is driven by Aguko Foundation, where we basically bring access for medical services closer to the community. We've done this for the 3rd annual time now. We have great support from the county government who gives us approval. We have great support from the community health promoters, the Sub-County Hospital, among other partners who have supported us in this particular initiative to ensure that we bring access of medical services closer to the community and to the people.
My name is Aguko, Director for Public Health and Sanitation of Kisumu County. Today we are happy that we are here on this free medical camp. The county government of Kisumu, through Jacaranda Sub-County Hospital and Aguko Foundation have brought free medical camp, and this has been practice for Aguko Foundation. Every year they do this for the past 3 years, and we are happy that we are partnering today. And we are bringing in a lot of services. This is an integrated free medical camp, but also integrated with social services.
So Kadibo community is a community that is prone to floods. A year and a half, 2 years ago, the communities that we are looking at today were actually coming from camps. They're just recently returning back to their homes. So these are communities that have been adversely affected by floods. And the floods are coming, of course, from River Nyando bursting its banks, and also we have the backflow from Lake Victoria that has greatly affected the community. So most of the community members were displaced. They were in camps, and we felt the need that, how can we support this community better? So we started by bringing the first medical camp to the community, and we realized the need that was actually there. So far, we've been able to see close to 5,000 community members across the medical camps that we've brought. We've been able to bring a range of services. That's from, general health care checks. We have diabetes checks. We have optical, dental, all those services we've been able to bring to these particular communities and ensure that they get the services closer to them. Why are free medical camps necessary to rural Kenya? So you realize that majority of communities today, as much as health is devolved, but there's still the question of access. And then there's still the question of affordability, right? So what is affordable to me is probably not affordable to someone else. Now, we find a scenario where the communities have the sub-county hospital, but when you talk to the sub-county hospital, they'll tell you that the cases they admit of malaria are people who are not coming to them. So the key question is why? We got like 3 or 4 cases today from malaria. And in fact, in this particular camp, the biggest case we've seen are malaria cases that have surged, right? And you see that in the numbers. And one of the things we're asking ourselves is why, right? And what is coming out clear to us is that people know that they need to go to hospital, but they believe that they're going to pay. They don't have the money to pay. So free, of course, is not sustainable, but sometimes it's also necessary. So we bring it to them, and at that particular point, we also educate them in terms of sustainable ways of ensuring that they're able to get access. For example, we have share registration going on. 3/4 of the people who are coming here are not registered in share, right? And it's a surprise to us, right? Because we're seeing that there's a need for them to actually get medical services. They still believe it's expensive, yet government has provided SHA for them to actually access Medicare. So we've brought in SHA registration to support in bridging that particular gap. We've seen scenarios where people in this community were not aware of other specific conditions that were ailing them. and they believe that they're having challenges. For example, there's a lady called Anna. I will call her grandmother in this particular instance. She's probably 78 or 80 years old. I'm not sure about that, but we can double check from the records. The lady has been at home blind. She knew she was blind. When we brought this medical camp, she missed the last medical camp. She wasn't aware of the first one. She missed the second one, but by God's grace, she was able to see or be aware of this particular camp for actually brought here today. One of the things we were able to solve is that she was diagnosed with a condition called cataracts. For those who know about eyes, so cataracts is just a condition that blocks the retina area, so you're not able to see because of that particular blockage, and it can be corrected by surgery. She wasn't aware. She was, she wakes up in the morning, sits on a door, waits for her grandchildren to take her to other places. When she came to this camp, we had our partner, Foresight Eye Hospital, who were able to treat her. She's been scheduled to go for surgery. I'm pretty sure once she comes back, she'll be able to demonstrate to us whether she's seeing or not. So it's just a matter of time. She didn't know about that particular service. I'm glad that she's been scheduled for surgery. So, we leave everything else to God. So our vision beyond the third year is simple. Number one, we are not doing this as a standalone. The medical camps are not a standalone events for Aguko Foundation or a standalone activities for Aguko Foundation. That is why we never leave the county or Ministry of Health at county level behind. We ensure that anytime we're doing these particular camps, there's that integration with the nearest sub-county hospital to support. Our vision is basically to be a supportive wing of the sub-county hospitals or the health facilities that are already in the system to support them. Our goal is just to provide that access of services to the communities so that we complement what the sub-county hospital is doing. Remember, when you're running these particular communities, we bring the sub-county team to actually support. Why? Because they understand the communities better than us. They understand the type of ailments and the type of drugs, the type of conditions that the community members are having, and they are able to provide the best solution for them. Ours is basically just to work with different partners to ensure that we provide access to medicine, access to equipments, access to any other instruments that they can use to test for the different conditions that are affecting them. So beyond the future, we're still seeing an integrated approach with the existing health facilities, where ours is just to complement what they're doing, provide access while they implement all the other solutions.